Welcome, everyone. This presentation compares several leadership assessment and evaluation models commonly used in healthcare organizations. Effective leadership is directly connected to patient safety, employee engagement, financial performance, and organizational culture. Healthcare organizations need reliable methods to evaluate leaders, identify strengths and weaknesses, and develop future leadership capabilities. This presentation compares three widely recognized leadership assessment models, explains how organizations capture performance metrics, and discusses which model appears to be the most effective in today's healthcare environment. Before discussing specific leadership assessment models, it is important to understand why leadership evaluation is essential in healthcare organizations. Healthcare leaders influence every aspect of an organization, from patient safety and employee satisfaction to financial performance and regulatory compliance. Their decisions affect clinical teams, patients, and the organization's ability to achieve its mission. Effective leadership assessment allows organizations to objectively measure leadership performance instead of relying solely on opinions or annual performance reviews. By collecting measurable data, organizations can identify strengths that should be reinforced in areas where additional training or coaching may be beneficial. Leadership evaluations also contribute to improved patient outcomes. Research consistently shows that organizations with effective leaders experience higher levels of employee engagement, stronger teamwork, better communication, and improved quality of care. When leaders communicate expectations clearly and encourage collaboration and support staff development, employees are more likely to remain engaged and committed to delivering high-quality patient care. Another important benefit is succession planning. As experienced healthcare leaders retire or move into new positions, organizations need qualified individuals prepared to assume leadership roles. Regular assessments help identify high potential employees who identify leadership competencies and are ready for advancement. Finally, leadership assessments promote accountability. Leaders are expected to meet organizational goals while maintaining ethical standards, supporting employees, and ensuring patient-centered care. Using structured assessment models provide a consistent and fair process for measuring performance while encouraging continuous improvement. The first leadership assessment model is the Leadership Practices Inventory. This assessment is one of the most widely researched leadership development tools used across many industries, including healthcare. Unlike personality assessments, the LPI measures observable leadership and behaviors. Its purpose is to evaluate how frequently leaders demonstrate behaviors that contribute to effective leadership. These behaviors are organized into 5 leadership practices. The first practice, Model the Way, focuses on whether leaders demonstrate integrity and set an example for others through their own actions. The second practice, Inspire a Shared Vision, measures how effectively leaders communicate organizational goals and motivate employees to work toward a common purpose. The third practice, Challenge the Process, evaluates whether leaders encourage innovation, continuous improvement, and evidence-based change rather than accepting the status quo. The fourth practice, Enable Others to Act, measures collaboration, trust, delegation, and employee empowerment. Strong healthcare leaders recognize that quality patient care depends on teamwork and shared decision-making. The fifth practice, Encourage the Heart, focuses on recognizing employee accomplishments, celebrating successes, and creating a positive organizational culture. One of the greatest strengths of the LPI is that it combines a self-assessment with evaluations completed by supervisors, peers, and direct reports. This allows leaders to compare how they perceive themselves with how others experience their leadership behaviors. Because the LPI focuses on behaviors that can be developed over time, organizations frequently use it as part of a leadership development program, coaching, mentoring, and succession planning. The second leadership assessment model is the 360-degree leadership evaluation. Unlike traditional performance reviews that rely only on a supervisor's opinion, this model gathers feedback from multiple individuals who regularly interact with the leader. Typically, evaluations are completed by supervisors, peers, direct reports, and the leader themselves. In healthcare organizations, feedback may also come from physicians, interdisciplinary team members, and other healthcare professionals who frequently collaborate with the leader. The purpose of this approach is to provide a more complete and balanced picture of leadership effectiveness. Every person experiences leadership differently. Employees may observe communication skills, supervisors may evaluate strategic decision-making, and peers may assess teamwork and collaboration. Combining these perspectives reduces individual bias and provides a more accurate overall evaluation. The assessment generally measures competencies such as communication, professionalism, accountability, emotional intelligence, conflict resolution, coaching, decision-making, and relationship building. One major advantage of the 360-degree assessment is that it increases self-awareness. Leaders often discover differences between how they perceive their own leadership and how others experience it. These differences create valuable opportunities for professional growth. However, organizations must carefully manage the process. Feedback should remain anonymous to encourage honest responses and reduce fear of retaliation. Human resource professionals typically compile and summarize the results so leaders receive constructive feedback rather than isolated comments from individual employees. The third leadership assessment model is the balanced scorecard. Unlike the previous two models, which primarily evaluate leadership behaviors, the balanced scorecard measures whether leadership produces successful organizational outcomes. The balanced scorecard helps organizations monitor strategic performance across four major perspectives. The first perspective is financial performance, which includes measures such as operating margin, budget compliance, cost management, and resource utilization. The second perspective focuses on patients or customers. Healthcare organizations frequently evaluate patient satisfaction scores, complaint resolution, patient experience surveys, and quality of care measures. The third perspective examines internal processes. Leaders are responsible for improving efficiency, reducing errors, decreasing wait times, increasing productivity, and ensuring regulatory compliance. Metrics such as infectious rates, readmission rates, medication errors, and patients throughput often fall into this category. The final perspective is learning and growth, which emphasizes employee engagement, leadership development, staff retention, continuing education, and organizational culture. The balanced scorecard is particularly valuable because it connects leadership directly to measurable organizational performance. Rather than evaluating whether leaders demonstrate desirable behaviors, it evaluates whether these behaviors produce improved outcomes. Many hospitals review balanced scorecard metrics monthly through executive dashboards and quality reports, allowing leaders to monitor trends and make data-driven decisions. Now that we've reviewed each assessment model individually, it's helpful to compare how they differ and how they complement one another. The LPI focuses on leadership behaviors. It measures how often leaders demonstrate practices such as communication, collaboration, and inspiring others. Because it emphasizes personal growth, it is primarily used for leadership development and coaching. The 360-degree evaluation expands on this by gathering feedback from multiple perspectives, including supervisors, peers, and direct reports. This provides a more complete picture of a leader's interpersonal skills and how their leadership is experienced by others throughout the organization. The balanced scorecard takes a different approach by measuring the organizational outcomes. Instead of focusing on behaviors or perceptions, it evaluates whether leadership is contributed to improved financial performance, patient satisfaction, quality of care, and employee engagement. Each model has unique strengths, but no single assessment provides a complete picture of leadership effectiveness. When used together, they often balance approach by evaluating leadership behaviors, interpersonal effectiveness, and measurable organizational results. This combination helps healthcare organizations make more informed decisions about leadership development and performance improvement. Healthcare organizations collect leadership metrics from many sources. Behavioral metrics often come from employee engagement surveys, peer evaluations, and leadership observations. Operational metrics are collected through electronic health records, financial reports, patient satisfaction surveys, quality dashboards, and human resource databases. Organizations combine quantitative and qualitative information to evaluate leadership effectiveness more accurately. Each assessment gathers different types of information. The LPI uses standardized surveys to evaluate leadership behaviors. The 360-degree evaluation combines anonymous feedback from individuals who work with the leader. The balanced scorecard relies on organizational data systems that monitor financial performance, patient outcomes, quality measures, and operational efficiency. Combining these approaches provide a balanced assessment of leadership effectiveness. While each assessment provides valuable information, healthcare organizations benefit most from combining all three models. The Leadership Practice Inventory identifies leadership behaviors The 360-degree assessment provides comprehensive interpersonal feedback from multiple stakeholders, and the balanced scorecard measures whether leadership efforts improve organizational performance. Together, these models create a balanced evaluation system that supports leadership development while ensuring accountability for patient outcomes, employee engagement, financial stewardship, and strategic goals. While leadership assessments provide many advantages, organizations also face challenges. Employees may experience survey fatigue, or some evaluations may contain bias if participants fear retaliation. Successful assessment programs require confidentiality, organizational commitment, and regular follow-up. When implementing effectively, these models strengthen leadership development and organizational performance. Healthcare leadership directly influences quality, safety, employee satisfaction, and organizational success. Each assessment model contributes valuable information. The leadership practices inventory measures behavior. The 360-degree evaluation provides comprehensive feedback, and the balanced scorecard links leadership to measurable outcomes. Together, these models create a well-rounded approach to leadership evaluation and continuous improvement.